Hello, the following presentation will be about documentation related to assessment. We'll review some areas where nurses will find documentation about their patients that will be useful in planning care, as well as areas that nurses are expected to document certain types of data. First thing we want to talk about is a nursing history. So a nursing history is fully completed when a patient is admitted to the unit. For those of you who are in NURN 155, this is what we talked about when we talked about taking a nursing history. It's only done once when the patient goes to the unit, but it's a great source of information. Completion of the form and the assessment allows the nurse to gather data for the next step of the nursing process, and this data helps us provide a baseline assessment for our patient. The next thing is a flow sheet. So this is an example of a paper flow sheet. A flow sheet documents data quickly in an organized form. Commonly documented data includes vital signs, intake and output, safety checks, weights. For flow sheets, all team members can access the flow sheet, so our nursing assistants, our physicians, our OTs, PTs, dietary team, everyone can access the flow sheet. They provide trends over hours and days can be easily revealed this way, and it's often the first place then changes that vital signs are noted. So you see in the flow sheet that you see in front of you, you'll have the time of day and then the vital signs, and then maybe what type of med that the patient got. This is something called an AWA flow sheet, or an adult alcohol withdrawal syndrome flow sheet. It helps, has large amounts of data in one spot so they can see what vital signs were in relation to what medication was given. Here's another example of a flow sheet. This is an example of weight, vital signs, and pain. This is a flow sheet that a paper flow sheet that may be kept at the bedside or in the patient's chart. And then more commonly, what we're going to see in the hospital now are electronic flow sheets. And this electronic flow sheet actually puts in red the data that is abnormal for the patient. But it can give you good trends. So here you can see that the patient's blood pressure went from 130 over 70 to 160 over 80. And then you can also see that this flow sheet actually looks at data over years. Some electronic medical records are able to aggregate data over years. This really high blood pressure of 140 over 120 was in 2000, where this blood pressure of 160 over 80 was in 2002. So from this, we can see that the patient has had a history of having high blood pressure. Here's another example of a flow sheet where the electronic medical record has actually graphed the vital signs so that you can see visual changes in data. Different people like different things. Some nurses really like this because they're visual and they can see when lines dip and go up and down. They can notice trends. You'll find your niche and you'll understand which one works better for you. Personally, I like to look at numbers better than I like to look at the flow look at a graph. So progress notes. Progress notes are another place where we write information about our patient. The thing I want you to understand about a progress note is all disciplines write a progress note. Nursing writes a progress note, OT, PT, dietary, your physician, social work, case managers, they all write progress notes. So nursing progress notes come in a variety of forms. They come in SOAPy, API, PI. In your fundamentals of nursing class, you will be exposed more to actually how to write these types of notes. But I think it's important to talk about this as a type of documentation to understand that you're going to read other people's progress notes in order to identify what the plan of care is for your patient and how the patient is meeting their goals. So in order to function in a multidisciplinary environment, nurses need to read the progress notes of others. You may not always get to see the OT, or you may not always get to see the speech therapist, but you can always go back and read their note and understand what their goals for the patient are, just as they'll read your note to understand what your goals for the patient are. And we need to be working as a team. Sometimes that team can't always be physically together to exchange ideas, so this is a way that we communicate with each other as well. So this information will help you focus your assessment and allow you to understand the focus area of the other disciplines that you work with. Next, we have something called it can be called two different things. It can be called a Cardex or a patient care summary. In the paper environment, it's called more of a Cardex. And we have paper environments in our long-term care facilities or our assisted living facilities will have Cardexes. Most of our hospitals are now computerized. They have electronic medical records, and we call them patient care summaries. So it gives a summary of basic patient information, can give a summary of nursing duties as well. If you look at the screen here, this patient care summary talks about the patient's active problems, active medications that they're taking, any allergies they have. You can also find their meds, any consult orders. This one actually has their vital signs listed. Other things that you can find are the name of the provider, the primary reason for their hospitalization, some past medical history, current orders. If you need to know when a dressing change needs to be done, patient care summary would give you that. Or when blood sugars need to be done, patient care summaries would give you that. Nursing plans of care would be here. Nursing-driven orders such as patient education or consults would be here. Any type of scheduled testing would be here. Safety precautions would be here. Type of fall precautions they're on, if they're on seizure precautions or bleeding precautions or elopement precautions. Any activities of daily living, if they need assistance, or if they are up at liberty, they can perform ADLs themselves, or if they're a two-person assist. Other important things that are on here are emergency contact information. If there was an emergency for some reason and we needed to contact the family immediately, we could go to the Cardex and then give us that, or the patient care summary, and then give us that information. Also, code status, knowing if your patient is a do not resuscitate or a do not intubate, or comfort measures only, that information would be there as well. And then the allergies. So this is a electronic Cardex, and this is what a paper Cardex would look like. This paper Cardex is actually specific for something called CHF, or congestive heart failure. Some hospitals in the area don't say congestive anymore, and they just say heart failure, but it is the same thing. Here you can see in the upper left-hand corner they'll put what the diet is, and if they have any fluid restriction, if they have IV fluids, if they're to have nothing by mouth, and these things would be filled in or circled or identified in some way. If they have neurological checks, you can also see here in the kind of in the top in the middle that this patient would have vital signs every 4 hours. They'd have INO every shift, pedibed elevated. So it has some mobility things here, the type of oxygen that they're on, height, weight. Gives us a nice general summary of what the care for this patient is.